Hello everyone. Today we'll look at the role of a pathologist. What exactly is pathology? If we look at biological sciences, medical sciences as a tree, then biology is the basic root of all of this basic science. Then comes the first year subjects which we study, like anatomy, physiology, and biochemistry. Then, if we look at the broad clinical subjects like medicine, surgery, along with that, pediatrics, gynecology, ENT, ophthalmology, all of these things, and all other clinical specialties. So, they see the patient, treat the patient, and the basic sciences give them an idea as to what exactly the disease is. But if basic sciences are the roots, and all these clinical subjects are the leaves and branches and everything, then what connects these two is pathology. So pathology is the trunk of the tree of medicine, which connects basic sciences to clinical sciences. Now let's see, in a hospital setup, where does the pathologist fit in? See, a clinician is seeing the patient. He'll ask history, he'll examine the patient like this and everything. And most of the times, clinicians may be able to just come to a diagnosis and give a treatment or manage the case based on this much only. But nowadays, as science is progressing, we do need confirmation before treatment. And so, most of the times, they send investigations to a lab. Okay. But most of the investigations are basic investigations. Like most of these are investigations in biochemistry and sending cultures for microbiology, etc. But there may be many cases where a doctor or a treating clinician may require somebody to look at the tissue of a patient, or say this patient has some problem within his chest and the doctor thinks there is some fluid within the pleural cavity. Then he'll take an X-ray, and if he sees there is fluid within the pleural cavity, what he'll do is he'll put a needle inside, take out the fluid in a bottle and send it to the pathologist. Pathologist will see the cells and tell the clinician what exactly is wrong with the patient. The clinician can manage accordingly. So this is one of the basic clinical scenarios. Now we'll look into main subspecialties of pathology. Okay. Most pathology labs will have these sub labs or subspecialty labs, whatever you call it. So almost all pathology labs will have a clinical pathology lab. So clinical pathology in very simple terms is study of body fluids. That's it. So what all are the common body fluids which come to clinical pathology? Let's imagine this is a patient, poor drawing. Say one is CSF. Then we have lungs here with pleural cavity surrounding it. So pleural fluid. Okay. There is a heart in the middle. So pericardial fluid. In the abdomen, peritoneal fluid. Then urine, feces. Okay, so these are the most common samples which come to clinical pathology, and at the very basic level in clinical pathology labs we look at what is the total count or total WBC count of these fluids, what type of WBCs are present, like that. And probably the most common sample which comes to clinical pathology is urine. Okay. Next is hematopathology. Now, hematopathology is basically study of blood. So as you can see, this is a peripheral smear. So these are RBCs, WBCs, etc. So in hematopathology, patient's blood is sent to pathology lab, and usually CBC is done, complete blood count, then peripheral smear, and in some occasions bone marrow examination. So these are the most common tests done in hematopathology. Now there are two more subspecialties. One is histopathology. Histopathology basically means study of tissues. So imagine this is skin. This is skin. So just imagine a scenario where this is the skin of a patient. There is some problem here. Patient has some lesion here. Clinician needs a pathological diagnosis. So he can do two things. One is he can do a biopsy like this. He will cut off a small portion of the skin like this and send to pathology lab, where a pathologist will see the process and stain and everything and see the skin under the microscope. So this is a microscopic picture, and he'll tell the clinician what is wrong. The other method is, instead of cutting out a small tissue, he can scrape out only the superficial parts and see individual cells rather than seeing the tissue as a whole. Pathologist can give a diagnosis based on this seeing individual cells. When you study individual cells separately, like this is one cell, this is cytoplasm of the cell, this is a nucleus. Again, here is another cell, this is cytoplasm, this is a nucleus. So by looking at these cells, if a pathologist can give a diagnosis, it will be easier for the patient, or probably mostly like when you give a diagnosis based on single cells, diagnosis may not be as accurate as histopathology, but it will be in many cases adequate enough for the clinician to go ahead with management. So that is called cytopathology, when you study individual cells. So thank you all. See you in the next video.